Hey everyone, let's talk about the hidden dangers of low blood pressure in women. Low blood pressure in women, it's like your body's trying to whisper important messages, but sometimes you're too busy to listen. So today we're going to turn up the volume and decode those signs. Trust me, your body will thank you for tuning in. Hey everyone, I'm excited to be with you today. As a vitality specialist and a health coach, I've spent years researching and studying the intricacies of women's health. Right now, we're going to talk about something that doesn't always get the attention it deserves: low blood pressure in women. You might be wondering, why is this so important? Well, let me tell you, understanding these signals can be a game changer for your health. Low blood pressure, or hypotension, is defined as having a reading below 90/60 mmHg. This seemingly simple number can have a big impact on your overall well-being. In this video, I want to share with you some symptoms, causes, and effects of low blood pressure in women. And by the end, you'll have the knowledge to make proactive health choices. So, are you ready to become a vitality athlete? Let's dive in. Now that we're diving in, let's talk about how your body communicates. Have you ever felt a sudden, overwhelming sense of doom for no apparent reason? It might not just be anxiety. Your body could be desperately trying to tell you something about your blood pressure. This feeling of impending doom is actually one of the less known symptoms of a sudden drop in blood pressure. Pretty wild, right? So let's not get ahead of ourselves. I've seen firsthand how low blood pressure can affect women's daily lives. So let's break down the more common symptoms that you might experience: dizziness, fainting, fatigue, weakness, blurred vision. And these are all ways that your body might be signaling that something's not quite right with your blood pressure. Now, here's something interesting. I've discovered through my research, women often experience these symptoms more intensely than men. Why? Well, it's all about your unique physiology. Your hormonal changes during menstruation and pregnancy can affect how your blood vessels dilate, making women more susceptible to these low blood pressure symptoms. Let me share a quick story with you. I once had a client who felt lightheaded and dizzy after a routine dental procedure. She thought it was just nerves, but when the dentist checked her blood pressure, it was surprisingly low. This experience really highlights how these symptoms can sneak up on us in everyday situations. Now, I want to introduce you to a term you might not have heard before: orthostatic hypotension. It's a fancy way of saying your blood pressure drops when you stand up. This is particularly dangerous for older women because it can lead to falls and serious injuries. So if you ever feel dizzy when you stand up quickly, pay attention. Your body might be trying to tell you something important. You might be wondering, why should I care about all this? Well, here's the thing. Recognizing these symptoms early can prevent more severe health complications down the road. It's like being a detective for your body. The more clues you can pick up on, the better equipped you'll be to maintain your vitality. Remember, as vitality athletes, we're not just passive observers of our health. We're active participants, always learning and adapting. By understanding these signals, and you're taking a huge step towards proactive health management. You've learned to listen to your body, but there's more to the story. What if I told you that your blood pressure could be creating a traffic jam inside your body, potentially starving your vital organs of the nutrients they need? Let's explore how this internal congestion might be affecting your health in ways you never imagined. When we talk about low blood pressure, we're not just dealing with a few dizzy spells. It's like a domino effect in your body, where one small change can trigger a cascade of events. I've spent years researching this topic, and let me tell you, it's fascinating how interconnected our body systems are. Here's something that might surprise you. Chronic low blood pressure can actually reduce blood flow to your critical organs. It's not just about feeling a little lightheaded. We're talking about potential irreversible damage to your heart, brain, and kidneys. Imagine your body as a bustling city and your blood vessels are the roads. When your blood pressure drops, it's like a traffic jam forming on those roads, slowing down the delivery of essential nutrients and oxygen to various parts of your body. Now, here's where it gets really interesting for women. Research has shown that females actually have lower normal blood pressure range compared to men. And get this, your increased risk of cardiovascular disease starts as a systolic blood pressure of just 100 mmHg. That's lower than we've traditionally considered normal. Dr. Susan Chang, a leading researcher in this field, puts it perfect when she said, "Our latest findings suggest that this one-size-fits-all approach to considering blood pressure may be detrimental to women's health. This highlights why it's crucial for you to understand your individual normal ranges." So how do we stay on top of this? Blood pressure checks are the key. It's like doing routine maintenance on your car. You want to catch any issues before they become major problems by understanding your personal normal range. You're better equipped to notice when something's off if you'll do this. But here's the thing, and it's important. We're not just passive observers of our health. As vitality athletes, we're proactive. We're in the driver's seat, steering our health in the right direction. By understanding this domino effect, we can motivate ourselves to take action and potentially prevent serious long-term health issues. Now that we understand the domino effect of low blood pressure, let's uncover the root cause and practical solutions. What if I told you that the key to managing your blood pressure might be hiding in plain sight, woven into the fabric of your daily routine? The answer could be simpler than you think. In our clinic, I've seen how small changes can make a huge difference. Let's start by looking at some common causes of low blood pressure in women. Hormonal fluctuations, dehydration, and certain medications can play a role. For example, those antidepressants or diuretics you're taking might be affecting your blood pressure without you even realizing. Dehydration is another sneaky culprit. It's not just about forgetting to drink water. Things like vomiting, diarrhea, and even fever can lead to dehydration and a drop in blood pressure. And here's something interesting. When your blood volume decreases, so does your blood pressure. It's all connected. Now you might be wondering, how do I know if I actually have low blood pressure? Well, healthcare providers typically consider a reading of 90/60 or lower as hypotension. But remember, everyone's normal is different. That's why regular checkups are so important. But don't worry, there are plenty of ways to manage low blood pressure. Let's talk about some practical solutions. First up, hydration is key. Increasing your fluid intake can help boost your blood volume. And if you're on medication, your healthcare provider might consider adjusting your dosage. Here's a tip. This might surprise you. Compression stockings aren't just for long flights anymore. They can actually help manage low blood pressure by preventing blood from pooling into your legs. It's like giving your circulation a little boost. Now, let's talk about your diet. Eating smaller, low carbohydrate meals can help prevent sharp drops in blood pressure after eating. This is especially important if you experience postprandial hypotension. That's just a fancy word of saying your blood pressure drops after meals. And here's a simple trick. Avoid sudden position changes. If you're prone to feeling dizzy when you stand up quickly, try rising slowly and giving your body time to adjust. It's a smaller change that can make a big difference. Remember, managing your blood pressure isn't about drastic changes. It's about finding what works for you. Maybe it's adding a bit of salt to your diet or having more water sips during the day. These small tweaks can add up to big improvements in how you feel. All right, let's recap what we've learned about low blood pressure in women. We've covered the symptoms, causes, and effects, and how they can impact your daily life. But here's the crucial part. If you're experiencing consistent drops in blood pressure, especially with chest pain or shortness of breath, don't ignore it. These could be signs that your body needs immediate attention. As a vitality specialist, I can't stress enough how important it is to be proactive about your health. If you're concerned about your blood pressure, don't hesitate to seek medical advice. Remember, low blood pressure can be just as harmful as high blood pressure, so stay vigilant. Understanding and managing your blood pressure is the key part of maintaining your overall vitality. By taking charge of your health, you're setting yourself up for a more vibrant, energetic life. And that's what being a vitality athlete is all about. I'd love to hear your experiences with this and your journey as you proactively take charge of your health. So don't forget to leave a comment below. Give it a like and a share if you want to. I sure would appreciate it. Thanks. Have a great day.